Good morning, everybody. Today we are here to discuss one of the important investigation which we advise for the patients, what we call as echocardiography. And echocardiography is one of the tests which sometimes patient also opt, and he asks the question, sir, I want to know whether I am having block or not. Can it define? So we will discuss those issues, how it makes the difference in making the conclusions and which type of diseases we should opt for the echocardiography. So first let us understand what echocardiography is. So echocardiography is the ultrasonic evaluation of heart. So it is a non-radiation. We are putting some probes on, we put the probe on the heart and we take a multiple slices and define the cardiac anatomy. And it is going in the real time, means how when the heart is contracting, we are seeing its systole, means during contraction, and diastole when it is relaxing. We are seeing the valve status, we are seeing the muscle status, we are seeing the regional wall motion, means how all the muscles are moving during the contraction. So this will give an impression how your valves are, means any blocks are there in the valves. Valves means window through which the blood flow from one chamber to other chamber. So there are four valves: mitral, aortic, tricuspid and pulmonary. So these four valves are functioning well or not, it can be totally defined by echocardiography. Second comes how the muscles are. So if heart muscles is having disease, the pumping will be weak. So that behavior we are going to see during the echocardiography. So we can say the heart LV ejection fraction, which is around 55 plus. So 55 to 75 it can be. So if a person's heart ejection fraction, means ejecting capacity or the pumping capacity is weak, we can say your muscle is becoming weak. And sometimes we can give the impression why it is coming weak. Sometimes it may be due to only and only muscle, or it may be due to the previous heart attack or previous coronary related issues. So how to differentiate whether it is a heart attack versus it is a muscle disease? So in muscle diseases, usually the pumping will be of a different morphology during the contraction. We call as it will be generalized reduction of the contracting ability. While in the patient who are having coronary artery disease, particular coronaries are having abnormality we call as a hypokinesia, akinesia. So that particular territory will not be moving, and that will give an impression that probably you may have a heart attack or that particular coronary artery was blocked. And this correlation has to be done in light of your ECG. So a good echocardiographer always see your ECG, take a short history, and then he makes the impression while making the conclusion or remarks regarding your echocardiography. Other than this valve and muscles, there are some abnormality that we detect related to the congenital heart disease. So if you are having abnormal communications between the great vessels, or you are having any holes in the heart, the chamber is having some defect which is present since childhood, that can also be defined in echocardiography. So in summary, echocardiography provides the non-radiation evaluation of heart. It can give you the structural details of the heart, means how the heart is, whether it is normal or abnormal, how the muscles is behaving during contraction, how the heart pumping is there, what are the valve status, how the chambers are, whether they are well developed or not, and there is any defect, what we call a intra-arterial septal defect, ASD or VSD, ventricular septal defect, or great vessel PDA, patent ductus arteriosus. So these type of abnormalities can be easily picked up and even labeled by echocardiography. So let me summarize regarding the echocardiographic evaluation. So echocardiographic evaluation gives the impression regarding the heart structural abnormalities, whether your heart is having normal chambers or not, its pumping is normal or not, means functional capacity, and after that how the valves are behaving, and any defect like congenital defect like intra-arterial septal defect, we call as a ASD, VSD or PDA, which these are the common abnormality which we can detect, even label by doing the echocardiography. Thank you for watching. See you next time with some important topics related to the heart. Thank you.